Does cracking our knuckles cause osteoarthritis of the fingers? I'm Dr. Zara Kazmi, double board certified rheumatologist, and the answer is no. The joint fluid is present in a negative pressure area and it serves as an adhesive bond. When we crack our knuckles, small air bubbles form and these pop with a cracking sound, breaking this adhesive bond. It takes about 30 minutes for this adhesive bond to be recreated, so it takes about 30 minutes for us to crack our knuckles again. Although research from the 1990s shows that there is no chance or very little chance of osteoarthritis getting precipitated by this, but the research is weak. I still tell patients who suffer from hypermobility to avoid knuckle cracking activity, as this can potentially cause microtrauma and lead to degeneration of the joints later on. I hope that helps.